Hello guys, so today we'll be discussing about dental implants and its components. Coming on to first, that is implant fixture and its parts. So we have collar, which helps in managing the crestal bone stability and also helps in soft tissue stabilization. Followed by micro thread zone, which helps in reduction of the marginal bone loss. Then we have implant thread, which helps in gaining the firm anchorage into the bone after the implant placement. Lastly, the self-tapping groove, which helps in improving the primary bone stability and also helps in easy insertion of the implant. Whenever we visualize the surface of an implant from above, the internal cavity of an implant, it displays various types of internal and external connections. So these connections, they help in maintaining the precise fit for the prosthetic components. So coming on to the cover screw. So cover screw is small flat component which is placed on the top of the implant fixture. So its job is very simple but crucial because it seals the implant cavity and it protects its internal threads. Basically, the cover screw, it preserves the patency of the connection by preventing any soft tissue ingrowth into the implant connection. In the first clinical picture, we can see that the implant has been placed into the bone. Next, we take the cover screw, place it in the hex driver and screw it onto the implant surface. And after screwing it tightly into the implant surface, we suture back the tissue. So actually, the cover screw also helps the gum tissue to heal around the implant surface, keeping it undisturbed. And it is tightened up with the help of the hex driver. All the prosthetic components are tightened up with the help of the hex driver. We should remember this. Coming on to the next component, that is healing abutment. So to place the healing abutment, basically we need to make a minimal invasive incision over the crest of the ridge. After making an minimally invasive incision, we expose the cover screw. After exposing it, we remove the or unscrew the cover screw with the help of the hex driver. After unscrewing it, we place the healing abutment with the help of the hex driver and tighten it. So a healing abutment is a component that connects to the dental implant and it actually protrudes to the soft tissue. So in the last clinical picture, we can see that the healing abutment after placement, it is actually visible into the oral cavity. But in case of cover screw, the cover screw after placement, it is actually not visible in the oral cavity because we suture the tissue back and tissue heals afterwards. So the cover screw is not visible in the oral cavity, but the healing abutment after tightening is actually visible into the oral cavity. So after placement of 2-3 weeks and after waiting for 2 to 3 weeks, we typically left it into the soft tissue. After leaving it into the soft tissue, post 2 to 3 weeks, we get a healthy gingival cuff which forms around the implant platform. So this healthy gingival cuff, it actually provides access to the restorative platform of the implant. So this healing abutment, it is placed on top of the implant to guide the soft tissue and it helps in creating a natural shape and contour which helps in easy placement of the prosthetic components and lastly the prosthesis. This healing abutment, it is also referred to as healing collar, permucosal extension, permucosal abutment or a healing cuff. Coming on to next component, that is impression post. So impression post, it is that component which is used to transfer the implant hex position and orientation from the mouth onto the working cast. So in order to fabricate a process into a laboratory, we need to transfer the implant position and angulation similarly as that placed into the patient's oral cavity onto the models. So this we record with the help of the impression post. How are we supposed to do it is, in the first clinical picture we can see at the time of impression we need to unscrew the healing cap with the help of hex driver. After removal of the healing cap, we need to place the impression post and tighten it with the help of the hex driver. After tightening up the impression post, we need to make an impression with the help of silicone impression material. So the main role of impression post is to record the angulation and orientation of the implant placed into the patient's oral cavity, and we need to transfer it similarly onto the model which is being sent to the laboratory for the prosthesis fabrication. Moving on to next, that is implant analog. So implant analog, it is that component which has a different body externally, but its platform and connection are exactly similar to that of an implant. We can see in the first figure, though externally these two components are different. First is the original implant, second is the lab analog, but their connection is exactly similar to each other. So this analog, it is actually used to replicate the implant platform and connection into the lab mode. So basically it is nothing but a substitute which plays the role of an implant on a lab model so that we can fabricate a restoration. So lab analog, it connects to the impression coping, as we can see in the below figure. Impression coping or lab analog, they get connected to each other similar to that of an impression post and an implant. So whenever the cast is poured, lab analog, it replicates the exact position of the implant, which allows technician to fabricate a perfectly fitting crown. In the second figure below, we can see in the impression that the lab analog has been properly fitted into the impression coping in the impression. So last component, that is implant abutments. So these are the final components which are screwed into the implants and helps in holding the final prosthesis. So once the dentist has transferred the implant connection using the post and analog from patient's mouth to the working cast, so they send it to the laboratory. The lab person pours the model. After pouring the cast, the appropriate abutment is selected and is being screwed onto the analog on the cast. Okay. So after the final screwing of the abutment onto the cast, the prosthesis is fabricated over this abutment in the laboratory and sent back to the clinician. After receiving the work, the clinician removes the abutment from the cast and fixes it into the patient's mouth. After fixing of the abutment, the prosthesis is being cemented or screwed depending on the type of the prosthesis, that is screw retain or cement retain. Accordingly, the prosthesis is being fixed into the patient's mouth onto the abutment. So this is how the abutment, it acts as a main connector between the implant and implant prosthesis, and it also helps in providing the retention and support for the prosthesis. So this is all about the implant and its prosthetic components. For more, please do follow. Thank you.